Early warning signs of breast cancer women need to know. Hello and welcome back to Health Awareness. Today, we will be looking at some of the early warning signs of breast cancer you should never ignore. But before we delve into it, don't forget to smash that subscribe button and turn on the notification bell so you don't miss any of our upcoming health videos. To get started, here are some quick breast cancer facts. Breast cancer ranks among the prevalent forms of cancer affecting women, constituting over 10 diagnoses. To put it into perspective, approximately 1 in every 8 women in the United States confronts invasive breast cancer. However, detecting this condition early poses a challenge. How does one conduct a self-examination? What are the risk factors associated with this formidable illness? Rest assured, we'll explore these aspects in today's video. Let's start with a preliminary self-examination. In the early stages, breast cancer might not exhibit clear indicators, gradually progressing without overt signals. Therefore, prompt identification of this stealthy threat is paramount. How can you achieve this? Conducting a self-examination is the simplest approach. Women possess an intimate understanding of their bodies, allowing them to notice abnormalities or alterations through self-inspection. One way to perform a self-breast examination is through visual examination. To do this, 1. Stand facing the mirror shirtless, with your hands at your sides. 2. Closely look at your breasts and watch out for unusual wrinkling and changes in size, shape, and symmetry. 3. Place your hands on your hips and see if you notice any abnormalities. 4. You can also use your hands while inspecting your breasts. 5. Use the pads of your 3 middle fingers instead of tips to examine your breasts. Your finger pads will be more sensitive to feeling and detecting abnormal growth or lumps. If you have difficulty feeling, you can use another sensitive area like the back of your fingers or palm, whatever you deem fit. 6. Next, apply pressure slowly to analyze the depths of your breast. Then increase the pressure to feel more of the breast's contents, but be firm when feeling the extreme depths of the tissue close to your ribs. Remember to take your time with it. Be careful that you don't hurt yourself. Now, to ensure thoroughness, we recommend adhering to a specific pattern during the self-exam. Commence from your collarbone, proceed towards the nipple, and then backtrack along the outer edge, addressing each section systematically. For added convenience, conducting the self-exam while lying down can be beneficial. This position helps spread the breast tissue, making it thinner and facilitating a more comprehensive assessment. At what point should you see a doctor? Occasionally, lumps can trigger false alarms. Breasts undergo numerous changes due to age and varying menstrual cycles. It's crucial to recognize that these changes aren't uniform. Each person's breasts are unique. Despite this individuality, it's essential to discern between normal and abnormal characteristics. Seeking medical advice is advisable if you notice any of the following signs. 1. Redness or swelling. 2. Dimples, puckers, ridges, or bulges on the skin of your breast. Prominent thickness in the breast tissue. If you notice a prominent thickness or density in the breast tissue compared to the surrounding areas, it's important to seek medical advice. Any noticeable variation in thickness or density should be addressed by a healthcare professional for further evaluation and guidance. 4. A hard lump or knot under your arm. 5. Unwarranted pain or warm sensation. 6. Itching, rashes, and sores. 7. Bloody nipple discharge. 8. Any recent inversions of the nipple where it seems to be pushed inside instead of sticking out. 9. Sores or injury on the breast that fails to heal. Now what? Following a physical examination, your doctor might recommend a series of diagnostic tests. One such test is a mammogram, particularly if there's suspicion of a tumor. A mammogram is an imaging test that offers a detailed view of the structures beneath your breast tissue. For women aged over 40, regular annual mammograms are typically advised to screen for breast cancer and eliminate any potential risks. Another diagnostic procedure that might be recommended is an ultrasound. This test employs sound waves to create a visual representation of your breast tissue's depths, aiding in the identification of underlying cysts or tumors. In cases where mammograms or ultrasounds reveal concerning indications of breast cancer, your healthcare provider may suggest a breast biopsy. This procedure entails extracting a tissue sample from the suspected area and sending it to a laboratory for a comprehensive analysis. This analysis helps in confirming or ruling out the presence of cancerous cells. What are the risk factors involved? Every disease is associated with a set of risk factors that may increase the likelihood of its occurrence. While some factors are beyond our control, adopting preventive measures can aid in averting potential diagnoses. To begin, let's address the unmodifiable risk factors, which are elements beyond an individual's control. Unmodifiable risk factors. 1. Females are more prone to developing breast cancer, primarily due to their biological composition. This inclination is linked to increased hormone stimulation, the fluctuating balance of estrogen and progesterone throughout various life stages, such as adolescence, menstrual cycles, pregnancy, and menopause, contributes to this heightened vulnerability. On the other hand, men possess considerably lower estrogen levels, and it's exceedingly rare for them to develop breast cancer, accounting for less than 1 of all reported breast cancer cases. 2. Breast cancer presents an escalated risk as individuals age, and aging is an inevitable part of life. The likelihood of developing breast cancer increases progressively with age. Around the age of 40, the risk elevates to approximately 1.5, further rising to about 3 by the age of 50, and surpassing 4 as individuals reach their 70s. Intriguingly, a significant proportion, specifically 80%, of individuals diagnosed with breast cancer are aged over 50 years. 3. Genetics and race. Genetics and race contribute significantly to breast cancer risks. About 20% of individuals diagnosed with breast cancer report having a first-degree relative parent, sibling, or child with the same condition. Moreover, the risk intensifies if the first-degree relative developed breast cancer before reaching the age of 50, further heightening the likelihood of an individual developing the disease. 4. Family history. A family history of ovarian cancer can heighten the risk of developing breast cancer due to specific gene mutations like BRCA1 and BRCA2. These genes, inherited from parents, typically serve as protective factors against certain cancers. However, mutations or alterations in the DNA sequence can impair their functioning, potentially paving the way for cancer development. When these faulty genes are inherited, there's an increased likelihood of developing breast or ovarian cancer. Nonetheless, having one faulty copy of these genes inherited from either parent doesn't guarantee cancer development. Generally, an individual has 2 copies of these genes, one from each parent. Cancer may arise if the second copy of the gene mutates over time, resulting in 2 damaged genes, thus increasing the risk of cancer manifestation. 5. When considering race and ethnicity, significant disparities exist in breast cancer prevalence and outcomes. White non-Hispanic women exhibit the highest incidence of breast cancer, meaning they are more frequently diagnosed with the disease. However, despite having a lower incidence rate, Black women tend to experience higher mortality rates associated with breast cancer. These racial disparities highlight variations in both diagnosis and outcomes among different ethnic groups concerning breast cancer. The disparities in breast cancer prevalence among different ethnic groups stem from multifaceted factors. While the exact reasons for these variations remain unclear, some theories propose that socioeconomic backgrounds and access to healthcare systems significantly influence these disparities. Access to better healthcare facilities and resources often results in improved survival rates for individuals with breast cancer. And that's it for today's video. If you find this content informative, don't forget to smash the subscribe button, turn on the notification, so you don't miss any of our upcoming health contents.